Heat Stress and Employer Readiness. Today's webinar will be presented by Concentra's National Medical Director of Medical Surveillance Services, Dr. Ronda McCarthy, and Concentra's Director of Product Development, Melissa Hay-Boggs. At the conclusion of the presentation, we will have a 10 to 15 minute Q&A session with the presenters. You can submit your questions throughout the presentation to be answered during the Q&A. We will answer as many questions as possible within the time allowed. A recording of the webinar will be emailed to you after the presentation so you can view it again at your convenience. Melissa, we're ready to begin.
Thank you, Anna. We'll start by covering some of the learning objectives for today. Occupational heat and heat-related illness conversations are becoming more and more prevalent. How can employers anticipate adverse related health effects in workers when research on heat stress in the work settings are few? Today we're going to examine employer practices to mitigate occupational heat stress and heat-related illness. We're also going to discover the results of a successful employer-based occupational heat stress prevention program. First, we'll begin with a little bit about increased ambient temperatures. Heat stress is a global phenomenon. In the past 140 years of National Oceanic and Atmospheric Administration's data, 5 of the warmest years on record have occurred since 2015. In January, the NOAA and NASA released that the hottest decade on record was 2009 to 2019. Extreme temperatures or increased ambient temperature is in every region of our country. What does that mean for us? It means longer hot seasons, more days over 90 degrees Fahrenheit, and increased frequency and duration of heat waves. With this comes the health effects of extreme temperatures. Dr. McCarthy, I'd like to hand it off to you now to share information about the health effects of extreme temperatures on workers.
Thank you, Melissa. The health impact of increased ambient temperatures on those populations most exposed to hot environments will be compounded. OSHA states that every year, thousands of workers become ill from occupational heat exposures, some fatally. Over the years, heat-related illnesses have been under-recognized and underreported for a variety of reasons. But recently, there's been an emphasis on understanding heat stress and heat-related illness. And with this additional awareness, we also know, as OSHA states, heat illnesses and fatalities are preventable. Next slide. Thank you. Occupational heat exposure has direct and indirect impacts. The direct impact of excessive heat exposure can range from heat rash to heat stroke, which can be fatal. Heat-related illnesses, such as heat exhaustion, must be taken seriously. Heat exhaustion can quickly lead to heat stroke if not addressed. Heat stroke is a medical emergency. Any delay in treatment increases the worker's risk of permanent organ damage and death. It is differentiated from heat exhaustion with higher core body temperatures, neurologic involvement, and multi-organ system dysfunction. Other serious heat-related illnesses include dehydration, rhabdomyolysis, renal failure, chronic kidney disease. The key point to remember is that heat-related illnesses and death are preventable. On this slide, we have examples of the indirect effects of heat stress, which impact the entire company. For an example, a forklift driver for a large manufacturing company is loading semi-trailers in and out of a hot, humid warehouse mid-July. His safety glasses become fogged. He becomes disoriented running his forklift into a stacked product, injuring himself and a coworker. The employer's accident investigation reveals prior to the incident, the forklift driver was operating at 50% reduced performance and complained to a supervisor of headache and fatigue. The driver was offered ibuprofen and some coffee and encouraged to complete a shift because of distribution demands. Now the employer has 2 OSHA recordable workers' compensation claims. Heat stress does have indirect effects, including increased accidents, reduced work performance, and increased costs, including health care and workers' compensation costs. Next slide. To create a site-specific program for the prevention of heat-related illness, for heat-related illness, you must first understand worker-specific risk factors. The risk factors can be grouped into 3 main categories: environmental, job-specific, and personal. The National Institute for Occupational and Safety Health, NIOSH, publishes recommended occupational exposure limits for heat stress. These limits are consistent with those of the American Conference of Governmental Industrial Hygienists, the ACGIH, threshold limit values for heat stress and strain, which specify maximum combinations of environmental heat measured as wet bulb globe temperatures and metabolic heat workload, or the job-specific, to which workers can be exposed. Exposure limits are lower for those workers who are unacclimatized to heat, who wear work clothing that inhibits heat dissipation, and who have predisposing personal risk factors. So those would be the individual or personal risk factors. On this slide, we'll look at the thermal environmental risk factor. Environment is the obvious risk factor that most of us can agree on, but we must take into account measurements captured by the wet bulb globe temperature, which is temperature, humidity, wind speed, and solar radiant heat. If the wet bulb globe temperature measurement is not available, other environmental risk factors to consider are the heat index. Also, is the work site urban or rural? Keep in mind that the urban heat island effect. Is the work primarily indoor with exposure to furnace heat or other hot surfaces, or are you working outdoors, or the workers working outdoors with exposure to radiant heat from the sun, or is the work a mixture of both? On this slide, next slide is the risk factors for job specific, which can increase workers' metabolic heat load and net heat load, and they include the workers' physical demand, which may be moderate, heavy, or very heavy, such as a firefighter, which are defined by the ACGIH. Duration of exposure needs to be considered. Do you have 8-hour shifts, 12-hour shifts, overtime, or shift work? Second shift tends to be the hottest shift. Protective personal equipment must be considered, such as respirator, hard hats. And right now, with the COVID-19 pandemic, we have many more workers wearing respirators, usually an N95, as part of the job requirement. This is important to keep in mind because workers exposed to heat with a respirator may add additional heat stress by the fact that they are covering their face, their head, especially if it's more than an N95. It also can increase the cardiovascular demands of the individual, and respirators also impede persons from maintaining hydration. Next slide. There are also personal risk factors to keep in mind as the net individual thermal load. These factors affect the worker's ability to thermoregulate the external and internal heat loads. They are less obvious, but a very important factor in a heat illness prevention program. The COVID-19 pandemic also adds another complexity for workers returning from furlough back to a hot work environment. And we are approaching summer as well for those outdoor workers. Individuals who've been out for a few months may have become more physically unfit. They have poor physical fitness. And now, if they have exposure to indoor heat, they become unacclimatized to the heat as well. Next slide. So we have reviewed the employer's risk factors, so the specific worksite risk factors that can contribute to heat stress. So now let's look at a specific heat stress prevention program.
Thank you, Dr. McCarthy, for covering the risk factors. Just to share a little bit about heat stress prevention programs, there's a few things that employers need to consider up front. First, what are the applicable state or federal regulations? Currently, OSHA does not have a heat standard. Therefore, worker protection must fall under OSHA's General Duty Clause, which states that employers must provide employees environments which are free from recognized hazards that are causing or likely to cause death or serious physical harm. But there are also a few states that have a specific heat standard in place today. Those are California, Minnesota, Washington, and the U.S. military. By 2022, Maryland will also have a state-specific heat standard.
Thank you, Melissa. When developing a heat stress prevention program, use your existing federal or state standards for general or construction industry that provides for personal protective equipment such as cooling vests, potable water, training to render first aid and avoidance of unsafe conditions, adequate first aid supplies, and provisions for medical care. So be sure that you're providing and meeting these existing standards. Next slide. Other essential resources that may be used to develop specific heat stress prevention program are the OSHA Technical Manual chapter on heat stress and NIOSH's criteria for a standard, occupational exposure to heat and hot environments, which is referenced throughout OSHA's technical manual. In this way, you are ensuring you meet OSHA's expectations for worker health and safety. So we have assessed the site-specific risk factors, taken into account the applicable federal and state mandates, and now using OSHA and NIOSH's resource, let's apply the hierarchy of controls for occupational heat exposure. As most of you are aware, elimination of the exposure is the most effective control. PPE controls are the least effective. The heat stress prevention program that we will discuss will focus primarily on the levels in between engineering and administrative controls. This slide shows an overview of the basic controls common to most heat stress prevention programs. These controls are implemented by risk level based on heat index. When the heat index reaches about 90 degrees, then have in place provisions of drinking water, medical services, supervisor and employee training on heat stress and heat-related illness and first aid, and your acclimatization plan. Each risk level that above adds the below measures to the adds measures to the prior risk level. You can find more information on this concept using the heat index as a level of administrative controls in the Guide for Employer Resources that are linked at the end of this presentation. Let's look at engineering controls. Basically, if you cannot eliminate the heat, you cool the environment. Engineering controls that factor into the wet bulb globe temperature are the most effective. Decreasing the temperature by air conditioning or providing cooling booths or air-conditioned break rooms. Increasing the wind speed, ventilation, cooling fans. Decreasing the solar radiant heat with shade. Decreasing humidity, exhaust fans near heat and moisture production. This slide shows an example of outdoor engineering controls by provision of shade. The next slide shows personal protective equipment considerations that include cooling vest, wetted garments. Also, when working outdoors, clothing should be loose-fitting, light-colored, and lightweight. Long sleeves should be included when the environmental temperatures exceed body temperatures. Administrative controls are many, and these changes can be made with just little planning and little to no cost. I mean, some planning and little to no cost. And as I showed before on the prior slide, can be implemented as the heat index rises, and they are some of the key factors in preventing heat-related illnesses, and are very common to most work sites. Let's look more closely at these. On the next slide, you'll see that an example of a NIOSH recommended acclimatization plan when a worker has been, when an acclimatized worker has been away from the work site either for an illness or a vacation. Also underneath is an explanation of new workers acclimatizing to the work site that are a new hire going directly into a hot environment. So this is a key administrative control and that should be included in all heat stress prevention programs for newly hired workers and those workers returning from an absence. In a study from Aaron Tetson et al. Showed that U.S. occupational heat-related illnesses and fatalities from 2011 to 2016 that was published in the MMWR, the Monthly Morbidity and Mortality Weekly Report in 2018, showed that 80% of heat exposure deaths reviewed occurred in unacclimatized employees the first week or two of work. And there are several studies that are consistent with these findings. Next slide. Another key administrative control is supervisor employee training. In my experience in implementing heat stress prevention programs in my work, there were so many misunderstandings or myths about heat stress and how employees should take care of themselves when they got hot, that actually their understanding of what they should do would more than likely make their chance for a heat-related illness occur more quickly and cause it to occur than actually prevent a heat-related illness. So education is key. Employees and supervisors should understand the signs and symptoms of a heat-related illness, understand that immediate response is absolutely necessary, and then in high heat conditions that the buddy system is important, or access to communication, because those who are have heat exhaustion or near heat stroke can have neurologic changes where they may not know to seek help or seek immediate seek immediate help, and they need that buddy to go ahead and access that emergency response for them. Next slide. A great resource for supervisors and employees alike is the OSHA-NIOSH heat safety tool from the CDC. I even recommend this to the general public. The NIOSH heat safety tool is a free downloadable app for a smartphone, and it shows the current local heat index conditions. It gives you an hourly predicted forecast throughout the day. It also provides a risk level for heat-related illness, provides precautions. It gives you signs and symptoms of heat-related illness and first aid should they occur. Next slide. So, another important factor for a heat stress prevention program, if you have workers exposed above NIOSH's recommended exposure level, and this information is provided by OSHA and NIOSH, whether they're acclimatized or not, should be a medical monitoring program with the goal to minimize workers' health and safety from heat hazards. And it also provides feedback to employers' prevention program. The medical monitoring should be both pre-placement and periodic annually. And the clinician who provides the medical monitoring should provide a written medical opinion to the employer to provide information whether the worker is safe to work in the hot environment, or if they need any accommodation or further evaluation for any uncontrolled medical conditions. Next slide. The medical monitoring evaluation should include medical and occupational history with emphasis on past, present, and anticipated exposure to heat in hot environments. It should include history of prior heat illness, if the employee has any risk factors for heat-related illness. And the exam should have emphasis on their weight, their vital signs, cardiovascular system, respiratory, skin, among others. There can be laboratory testing that is included based on their medical history and physical exam to further confirm if they are safe to work in a hot environment. To evaluate the effectiveness of a heat stress prevention program, review data annually. Safety and health managers can look at the heat-related illness frequency, workers' compensation cost, and job-specific heat-related illnesses to make control interventions accordingly. I would like to share with you the results of a successful employer-based occupational heat-related illness prevention program. This is retrospective analysis of data collected, and it was published in the Journal of Occupational Environmental Medicine, September 2019. The analysis looked at heat-related illness occurrences in a group of outdoor municipal workers before and after the implementation of a heat illness prevention program. This research and analysis was made possible by my co-investigators at the University of Pennsylvania. So it was a program that I ran as a medical director for a municipality, and then as I am an adjunct professor at the University of Pennsylvania, and worked with Dr. Fran Schofer and Dr. Judith Green McKenzie to provide these results. We looked at outdoor workers that had a job description of moderate to very heavy physical demands with exposure to extreme heat that was included in their job description. Basically, I began the program when I noticed that the employer had several heat-related illnesses that were occurring. And I'm from Texas, Central Texas, and we have a very hot, humid climate. I did exactly what we discussed just now, looked at the OSHA technical manual on heat stress and the NIOSH criteria for a standard, which has been revised since I started with reviewing the standard, and implemented the administrative and engineering controls where possible. So we provided employee supervisor training, provision of water, rest, shade, and the medical monitoring. Since we provided all workers with those provisions, and we also had an acclimatization plan as well. But workers who were at higher risk for heat stress, which were identified on a screening questionnaire, we gave more individual heat-related illness prevention program training that was specific to their risk factors. And then those that were identified to have uncontrolled specific individual risk factors, we, since these were outdoor workers, we did most of the medical monitoring in the early spring before it became hot, and gave them a chance to get those factors controlled before it became hot. So even though that they were restricted from working in a hot environment, it would not yet become hot. So they most were not taken off work. And then those that had trouble with with some of their personal chronic health conditions, we offered them periodic rechecks throughout the hot season to ensure that they remained under control. So what were our findings? After we looked back, we did this for about 7 years. We had 2 years of data before, and then did this for about 7 years. And it was, about year 5 and 7 that I realized that we ought to look back at this data, because we had good results with the implementation of this program. We found that workers with 2 or more individual personal risk factors for heat-related illness were more likely to develop a heat-related illness. We also found that the median workers' compensation cost went down by 50% per illness. And this was thought to be due to the training and early identification. So persons came in quicker when they had signs or symptoms, so therefore their illness was less severe, so less costly. So it was per illness. Next slide. And finally, the total number of heat-related illness cases decreased after implementation of the heat stress prevention program. And in fact, the last 2 years there were no reported cases of heat-related illness during the hot season. And as you recall earlier on the section that Melissa discussed with the climate, on the climate, that the 2009 to 2019 as the recorded hottest decade by the National Oceanic and Atmospheric Administration's 140-year history. So this was in the hottest decade, and I think 2016 is one of the hottest years on record as well. And so, we went from about, 27 to 24 per thousand heat-related illnesses. 2011 was actually a really, really hot year. I was expecting us to get more reports because people were understanding what heat-related symptoms were. So I thought we would actually get more reports, but that was also a very hot year. And then we gradually went down to where we had no illnesses. And this was in a municipality who does not have to report to OSHA as far as their work injury. So there was no issues regarding reportability, and so they had their own employee health, and workers felt free to come in and provide reports regarding any injury or illness. So next slide. So the key takeaways: heat-related illnesses are 100% preventable. Research supports prevention program effectiveness in reducing heat-related illness and associated workers' compensation costs. So prepare now for occupational heat stress, its associated hazards, and its impact on productivity, direct and indirect costs, and most importantly, the health and safety of your workforce. And the next slide shows some links to some important areas that you can utilize for your own prevention programs, and just information that is very helpful when needing additional resources regarding just heat illnesses or first aid and safety and emergency response. Thank you so much. And you have time for any questions or answers. I know we used a lot of this time, so I don't know how much time is left for question and answers, but thank you.